Hello, my name is Jalitzis Nunez, and today I'm presenting the Richard B. Russell Jr. National School Lunch Act of 1946. It is best known as the National School Lunch Act of 1946. This act was proposed by Senator from Georgia Richard B. Russell and from Senator Slender from the Agriculture Committee of the Senate. And it was signed into law by President Truman on June 4th of 1946. The act was designated in response to concern about the health and nutrition of the country's children, which showed malnutrition during the World War II drafting, where many males showed malnourishment, underweight, and were unable to keep up with their military training. The idea of the act came after New Deal programs where school lunch were provided, and they were administered by a program called Work Progress Administration, WPA is best known. Social issues that this policy addressed were hunger and malnutrition. By providing lunch at school, the act protected children and made sure that they received at least one nutritional meal per day, providing health and a better intellect and also a growth. Some economic issues that the act addresses were the economic surplus, farm commodities that were provided, and that gave them outlet for the excess of produce, and they were supposed to provide those fresh produce to the school for the school lunches. Political issues that this act addresses. Hello, my name is Jalitzis Nunez, and today I'm presenting the Richard B. Russell Jr. National School Lunch Act of 1946. It is best known as the National School Lunch Act of 1946. This act was proposed by Georgia Senator Richard B. Russell Jr. and from a Senator of Slender. He was from the Agriculture Committee of the Senate. This act was signed into law in June 4th of 1946 by President Truman. The act was designed in response to concerns about the health and nutrition of the country's children who showed malnourishment, underweight during the military draft of the World War II, where males were unable to keep up with the military training. The idea of this act came after the New Deal program, where the school lunches were provided through the program called Work Progress Administration. Social issues that this policy addressed were child hunger and malnutrition. By providing school lunches, the act protected the children and were making sure that the children receive at least one nutritional meal per day, and which will help with their growth, their health, and their intellect. Economic issues that this act addressed, the act provided surplus farm commodities, giving an outlet for the excess of farmers' supply, who will be giving those fresh produce for the school lunches. A political issue that this act addressed involves was it reflected the federal government involvement in the public health and welfare. This is following the Great Deal's social welfare programs and also a post-war period. A stakeholder involvement on this act were the federal policymakers, which were basically the Senator Russell and Senator Slender, who were concerned with child malnutrition, but also they were concerned with the agriculture surplus. And they play a key role in the enactment of this act, as well as President Truman, who signed the act into law. Another stakeholder was the United States Department of Agriculture, who were then designated to oversee the program. All other interest groups were farmers, educators, and public health advocates, and local school districts who were lobbying and promoting the act. The main oppositor that this act had was Senator Robert Taft of Ohio, who considered the act to be too costly and with no significant help for the agriculture surplus. And the goals of this act are to improve child nutrition and health, support agricultural production, promote national security, and aid low-income families. The alignment of this act with the social work profession and values and ethic, core values and ethic are service. The program addresses food insecurity in schools, so it serves the most needy population. Also social justice, integrity and competence, and dignity and worth of the person are the other values that I found related to this policy. The implementation details of this policy: the United States Department of Agriculture is the federal agency responsible for the administration of the program. The state education agencies ensure compliance with and administrate the program at the state level, and the school districts implement the program at school level by serving the meals and preparing them. The United States Department of Agriculture worked with the state to develop the guidelines and funding distribution. Annual funding is assigned by Congress, and school districts applies for participation and are reimbursed per meal served. Some of the barriers that this policy possess is that funding challenges. This could lead to not appropriate meals being served, and also infrastructure limitations, like some schools don't have appropriate kitchen and trained staff. The intended outcomes of this policy were to improve child nutrition, support academic performance, strengthen food security, support agriculture, and national security. The unintended outcomes were the nutritional disparities. At the beginning of the program, there were not standards guidelines set for this, and also there were waste and inefficiency and the food waste. Some policy impacts, the policy impact on the target population, it was proposed to target low-income children by ensuring that they receive at least one nutritional meal per day, so they focus on strengthening their studies and not on what the next meal will be. Some disparities in impact across groups. Minorities groups like African American and Hispanics or Latinos are disproportionately enrolled at higher rates into the program. This is due to socioeconomic disparities. And also we have geographic disparities. Urban and rural areas, school districts may have different access to funding and also to food suppliers, leading to disparities in meal equality and availability. Some methods that are used to evaluate the effectiveness of this policy are surveys done by the United States Department of Agriculture and its administration, and also the program participation data. These are analysts examine trends in student enrollment and participation, and also do impact evaluations and cost benefits analysis. Some criteria used to measure the success of this policy were national improvement, health outcomes, academic performance, and attendance. Data available to support the policies outcomes are the reports done by the Department of Agriculture and the Government Accountability Office, who evaluate the efficiency and compliance with program administration. The strengths of this policy: nutritional support for children, educational benefit, and support for farmers. Some weaknesses or limitations that I could see: nutritional quality issues, administration burdens, and equity issues. This policy can be improved by enhancing nutritional standards and reducing stigma, increasing funding, and simplifying enrollment for the schools, making guidelines and rules less strict for farmers to get enrolled, local farmers to get enrolled in the program. Some ethical dilemmas: there were the stigmatization that families from low-income families, low-income levels experience when they apply for this program, and also nutritional quality and funding disparities. Some school districts receive more funding than others, sometimes because their geographic placement. This alignment with social justice, it promotes equity, addresses structural inequities, and government takes responsibilities, showing the idea that the state has a duty to care for vulnerable population, for especially children. Ethical dilemmas for social workers would be confidentiality. I would say that is the most, because some families may not be in accordance to reveal private information, making the enrollment process more difficult. And also another ethical dilemma would be working with undocumented families, as they may not want to be able to be enrolled just for fear of facing retaliation or legal repercussions. Some recommendations I can make: nutritional quality enhancement, increased funding and also reimbursement rate, or they could make free meals for everybody, so every child has access to this food.